Dr. Leisle, we've talked about that children should be keeping their teeth, even the baby teeth and stuff. Now, talk about some of the things one can do. You know, like I heard about sealants, for instance. And it's here and there, there's some controversy out there, like with everything. I mean, everything has some, you know, are sealants a good thing? How many sealants should one get? When should one get them? How long do they hold? A variety of questions mom doesn't know, because after all, it's always about spending money also. And why spend money if you don't have to, if it's kind of like so-so protective only?
Sealants are excellent. And they're for the permanent teeth. I don't do sealants on baby teeth. In my opinion, I don't think they're needed on baby teeth. They don't stick very well. I've seen sealants done on baby teeth, and many times they break out too easily because baby teeth have very shallow grooves. But on permanent molars, particularly, in my practice, some dentists do permanent molars and bicuspids. Bicuspids are the teeth that you get in usually around 10, 12 years of age. The molars, though, are very important to have sealants on. And the reason why is that it seals those grooves so food doesn't pack back there. I mean, if we look at it, Helmut, your mouth, my mouth, most adults' mouths, we have fillings in our mouths. And they're almost always in those back molars. Or we have crowns back there because the fillings have broken out after a while. So sealants are a way to protect that whole thing so you don't have that. They're inexpensive compared to fillings. They will last 7 to 10 years. They can last longer. But what needs to be stated, though, is that the child cannot eat anything. They need to stay away from hard candy, ice cubes, corn nuts, and generally sticky stuff too. I don't like them having the sticky candy, gum, or fruit roll-ups because they can pull those sealants out. But usually the hard stuff is the problem. As long as they stay away from that, they can eat any kind of food. They can have, chocolate. They can have ice cream. They can have snow cones, slushes. They can have crushed stuff. And then they're not going to break out their sealants. But the child that comes in, the teenager, say a 12, 13-year-old, has had sealants done, they're breaking them out once a year. Almost always, 99% of the time, it's because they're abusing them.
I see. Otherwise, they last 6, 7, 10 years, you said.
Yeah, definitely.
So, should a child have sealants on the second teeth also, or not yet? Not anymore?
Second teeth. Well, the permanent molars, yes, the first and second molars, if they have enough room for their wisdom teeth, I would definitely get those sealed. And like I said, some dentists do bicuspids. They're the smaller teeth that are in between the front teeth and the back. Some dentists do those also. Unless I have a child that's had a lot of fillings in their mouth, they come in, say, 8 years of age, they've had 9 years of age, they have lots of fillings in their permanent teeth, then that's a child I would put sealants on the bicuspids, because it tells me they're not always studious when it comes to oral hygiene. Okay, but most kids that come in, they're brushing well. They've learned it's a good idea to brush 3 times a day. Brush after carbohydrate intake, cookie, cracker, potato chips. Those kids, molars are what they need to have done. It saves a parent's money, and it saves a child to have nice aesthetic teeth the rest of their life. So they're not going to have a bunch of metal back there or plastic.
Okay, wonderful.